cases. All of these people are hospitalized right now. 18 people are now under medical observation. No imported cases reported in Beijing. And also there's no reported cases of suspected cases. Mission. We have taken the mission to have the prevention and control for the COVID-19 since June the 11th. Beijing municipal government has always put people's health and safety as the top priority. We are taking the most stringent and decisive measures and seize every minute and seconds to conduct large-scale screening, epidemiological investigation, as well as the virus tracing. We are taking a science-based approach for the epidemic prevention and control. For markets which involve in the outbreak and places with high and mid risks, people who are working in the healthcare sector, students who have been returning to school, and faculties who have been working at schools and universities. All these 6 types of people, we have conducted nucleic acid tests to these people. So to the key regions, key groups of people, we have taken stringent measures to curb the spread of the virus. We'd advocate people to take the nucleic acid test on a rational basis, so people can register their information in order to receive the nucleic acid test. For people who are not visiting any high and medium risk regions and have not contacted with people who are coming from those regions, please be calm. In accordance with the time and the arrangement of the community, please receive the nucleic acid test when necessary, so that by doing that, we can make sure that we can use all of those resources to the people and the places that most need it. And by doing all of that, we can reduce the risks of the transmission of the virus. We will fully mobilize the medical resources and improve our treatment system. And also we will focus on the nosocomial infection management and spare no efforts to treat our patients. By doing that, we would like to reduce the mortality rate and increase the cure rate. Also, we will use a combination of TCM and Western medicines to treat all of the patients. We will attach great importance to the prevention and control work in schools. And during the period of high school entrance exam and college entrance exam, we would like to make appeal to all the parents and students to not form gathering. And I will also make appeal to all the Beijing residents. Please abide by the prevention and control measures. Wash your hands frequently and do not form gathering. And exercise an appropriate social distance. And make sure that we can take stringent measures and protect our homeland. On one hand, we should focus on the prevention. On the other hand, we have to ensure the market supply and stabilize the price. In order to ensure the transportation of the supplies in Beijing, the NDRC has been working with Hebei province and neighboring cities with Beijing to provide necessary supplies to Beijing. We also establish a special channel to transfer all of the supplies to Beijing. And all of these transaction points will be operated 24 hours per day, 7 days a week. By doing that, we can provide the transfer services of the vegetables and fruits and allocate all of these resources back in Beijing. By doing that, we can provide the sufficient supplies in the markets in Beijing. And with the support of NDRC, JD Logistics Center has been shifting its warehouses to the temporary transaction site of Xinfadi Market. So for this project, we allowed 100 truck fleets to transport vegetables and the fruits to Beijing. And all of the fees will be standardized, and we would like to reduce the cost of the transportation of the fruits and vegetables. By doing all of that, we can ensure sufficient supply and stabilize the price of all the daily necessities in Beijing. And today we have representative from Beijing Education Commission, Health Department, and the relevant local authorities, as well as Beijing CDC, to brief us the information about the epidemic prevention and control. That will also address questions concerning the public and the residents. And first of all, I would like to introduce the speakers. With us today, we have the spokesperson from Beijing Education Commission Municipal, and Mr. Li Yi, and also the spokesperson from Beijing Health Commission, Mr. Gao Xiaojun, Deputy Director of Beijing CDC, Madame Pang Xinhuo, representative from Xicheng District, Mr. Guo Hailong, and Marketing Director from the Best Buy, Madame Fan Zhiming. And first, I would like to give the floor to Madame Pang Xinhuo to brief us the details on the new confirmed cases as well as the result of the epidemiological investigation. Friends from the media, good afternoon. Now, I would like to give you an update on the new confirmed cases on June the 20th. From 0 o'clock to 24 o'clock of June the 20th, Beijing reported 22 new confirmed cases, including 11 men and 11 women. The average age is about 42-year-old. The youngest one is 1 year and 7 months, and the oldest one is 86-year-old. 10 with Beijing permanent residents, and 12 are residents from other provinces. 10 cases in Fengtai, 8 cases in Daxing, 3 cases in Haidian, 1 case in Tongzhou, 3 mild cases, 19 normal cases. And we also completed epidemiological investigation for 17 cases, and 5 cases are under investigations. Now I would like to give you the details on all of these cases. Case 1, man, 25-year-old, from Hebei Province, lives in Huangchun town of Daxing District. He works for a food company in Daxing District. On June the 19th, he started to develop symptoms and confirmed as a COVID-19 cases as normal symptoms. Case 2, woman, 43-year-old from Beijing. She lives in Daxing District. She works for a food factory in Daxing District. She started to develop symptoms on the 19th of June and was classified as a normal case. Case 3, woman, 28-year-old from Shandong Province, lives in Daxing District, and she works for a food factory in Daxing District. She started to develop symptoms on the 18th and confirmed as a confirmed case on the 20th with normal symptoms. As of June the 20th, the food factory in Daxing District identified 5 cases in total. 2 people used to visit Xinfadi wholesale market. Based on the epidemiological history, their CT scan and blood results, and these people are in relation to the cluster outbreak in Xinfadi. Case 4, man, 57-year-old from Heilongjiang, lives in Huaxiang of Fengtai District. He works for Xinfadi Market, developed symptoms on the 18th and confirmed as a normal case on the 20th. Case 5, woman, 55-year-old from Heilongjiang. She lives in Huaxiang of Fengtai District. She works for Xinfadi Wholesale Market. She started to develop symptoms on the 15th and is identified as confirmed case with normal symptoms. Next one. Man, 27-year-old from Hebei, lives in Huaxiang of Fengtai District. He works for Xinfadi Wholesale Market. He developed symptoms on the 15th of June and identified as confirmed cases with mild symptoms on June the 20th. Next one. Man, 21-year-old from Hebei, lives in Huaxiang of Fengtai District. He works for Xinfadi Wholesale Market. Started to develop symptoms on the 19th of the month and is identified as confirmed case with normal symptoms. Case 8, a man, 47-year-old, from Shandong Province, lives in Huaxiang of Fengtai District. He works for Xinfadi Wholesale Market. He started to develop symptoms on the 18th, and he is identified as confirmed case with normal symptoms. Case 9, man, 50-year-old, from Beijing. He lives in Huangchun Town of Daxing District. He used to make a purchase from Xinfadi Market and started to develop symptoms on the 18th and is identified as confirmed case with normal symptoms. Case 10, woman, 59-year-old, from Beijing. She lives in Huaxiang in Fengtai District. She used to make a purchase from Xinfadi Market. She tested positive on June the 20th and she is identified as confirmed case with normal symptoms. Case 11, woman, 24-year-old, from Beijing. She lives in Xihongmen Town in Daxing District. She used to shop in Xinfadi Market, and on the 13th and the 14th, she tested negative in NAT, and on the 19th, she was tested positive for the virus, and she is identified as confirmed case with normal symptoms. Case 12, man, 55-year-old, from Beijing. He lives in Xihongmen Town in Daxing District. He used to purchase from Xinfadi Market. He started to develop symptoms on the 16th of the month and is identified as a confirmed case with normal symptoms. Case 13, man who lives in Beiyuan of Fengtai District. He used to purchase in wholesale market and is identified as confirmed case with normal symptoms. Case 14, man, 47-year-old, from Hebei Province. He lives in Haidian District, and he is a close contact of the case identified on June the 16th. He is identified as confirmed case with normal symptoms. Next case, woman, 86-year-old, lives in Haidian District of Beijing, and also a close contact with the previous confirmed case, and she is identified as confirmed case with normal symptoms. Case 16, man, 20-year-old, from Hebei Province, lives in Gaomingdian Street in Daxing District. He is also a close contact with a confirmed case, and he is identified as confirmed case with mild symptoms. Case 17, woman, 1-year-old and 7 months, from Hubei Province, lives in Huaxiang of Fengtai District, and her mother used to work in Xinfadi Market, so she is a close contact of the previous confirmed case, and she is identified as confirmed case with normal symptoms. All of these confirmed cases are sent to designated hospitals for treatment. Now I would like to make a reminder to the public. Please clarify your responsibilities and manage the population flow of your companies and manage the key groups of population and check your employees' health conditions and provide necessary education for the prevention and control. And please make sure that you disinfect the public facilities and all the workers should exercise a 1 meter distance with others. In close-off environments and indoor environments, make sure that you have a good ventilation so that you can reduce the risk of the transmission of the virus for all the companies. So you have to take stringent measures to curb the spread of the virus. That is my update. Thank you. Thank you, Madame Pang, for her update. Now I would like to give the floor to the marketing director from Best Buy, Ms. Fan Zhiming, to brief us their arrangement on the epidemic prevention and control. Friends from the media, good afternoon. Recently, the development of COVID-19 concerns people from China. So for my company, we have attached great importance to this issue, and also we have to ensure the food safety. After we found the cluster outbreak of Xinfadi Market, we immediately activate the level 1 response, and also we take necessary personnel to quarantine. At the same time, we are collecting samples for testing to make sure that all the products that we are selling is safe. Now I would like to give you an update on the current situation. First, we immediately activate the response. After June the 11th, we close our business on June the 11th, making sure that these products can be isolated and will not be transported to other places. And second, we have conducted an all-rounded screening and NAT to all the employees who have been working in my company. And on June the 20th, we have transported 486 people for centralized quarantine. However, these 486 people, they are testing negative for the test. And for all of their close contacts, they have been also staying at home for home isolation. And we'll strengthen the epidemiological investigation to strengthen our efforts in the large-scale screening. On June the 20th, we have traced down 87 close contacts. And all of these people are under medical observation. And fourth, we have conducted thorough disinfection to our factory, and we have already sent out the environmental samples to the testing center, and all of these samples tested negative. And on a daily basis, we will conduct 2 thorough disinfection to all the public facilities and the services of our places. And next, we will make sure that we can protect our food safety. I believe with the strong leadership of the municipal government as well as the Daxing government, we will contain the epidemic in our factory. Thank you. That is my update. Thank you for Madame Fan's updates on the epidemic situation in the Best Buy. Next, I would like to give the floor to the spokesperson from Beijing Health Commission, Mr. Gao Xiaojun, to brief us on the situation of the NAT. Friends from the media, good afternoon. Now I would like to brief you the nucleic acid test capacity in Beijing. Since the outbreak of COVID-19 in January this year, our city has attached great importance for the capability of nucleic acid test. All the 17 district CDC has the capacity to run NAT, and also 13 hospitals are able to run nucleic acid test. And in March and April, we have more institutions and agencies are able to provide nucleic acid test. And by the end of April, 61 institutions are able to provide the nucleic acid test in Beijing. So in early June, the number of testing centers increased to 98, and the daily capacity is 100,000 samples. As we identified the outbreak on June the 11th, we have further increased the capacity of nucleic acid tests, and right now we have 124 institutions able to run nucleic acid tests. So right now, the daily capacity is 230,000 samples. So we have like 73 hospitals are able to run nucleic acid tests, and 31 laboratories are able to provide the nucleic acid test. So on a daily basis, to the maximum level, we can testing over 1 million people. So in level 2 laboratories in Beijing, we have 15 are up to our standard and 12 are under supervision. And 12 laboratories are submitting the application for the nucleic acid test. In Shijingshan, Mentougou, Changping, Yanqing, altogether 5 regions, the testing completion rate is about 100%. Dongcheng, Chaoyang, and Huarou district, the testing completion rate is about 50%. In Fengtai district, the completion rate is 29%. In Haidian district, the completion rate is 25%. In Xicheng district, the completion rate is 20%. Fangshan, Daxing, Pinggu, Miyun, altogether 4 regions, the completion rate is 0. In Tongzhou district as well as the economic development zone, there is no level 2 testing centers. In Jingmi district, as they are not able to conduct the nucleic acid test for their level 2 laboratories, they will improve their capabilities in the testing for level 1 hospitals. Thank you. That is my update. Now I would like to give the floor to Mr. Li Yi from Beijing Education Commission. So he will brief us on the situation of the high school entrance exam and the college entrance exam. Friends from the media, good afternoon. Right now, the epidemic prevention and control remains severe, and we are at a special time. With the joint efforts of our students, faculties, as well as the parents, yesterday we are able to hold the listening examination for the college entrance examination. So right now, all of the examination sites are safe, and all of the procedures are running smoothly. On June the 17th, students are not able to come back to school, and also we are rolling out online education platforms to facilitate the students. First, I would like to brief you the updates on the English exam, on the college entrance exams in Beijing. So altogether, we have 39,142 students attending the listening examination for the college entrance exam. So we also provided over 10,000 testing equipments for the students. So we have a morning session and also have the afternoon session for the listening examination. And for some of the students, they have completed the exam successfully. In terms for the management of the exam, we will strengthen the management with joint efforts between different departments in Beijing. We also provide a lot of education to the students and parents on the prevention and control measures, and also we are doing a lot of work in direct traffic, and also we are working with the public security and the public transportation department to make sure that we can have a safe examination to all the students. And also we are providing a lot of guidelines to regulate the examination. During the examination, we have provided sufficient supplies, and also making sure that all of these students are safe during the procedures of the examination. And third, we have provided targeted services, and for some students who are falling into a special group, they also are able to complete all the college entrance examination. I have given you a lot of updates about our arrangement in the high school entrance exam and the college entrance exam, because right now these two exams are taken at a special time. It is also a large-scale examination. And this is actually a chance for us to test our governance, and also it will lay a solid foundation for us to implement the examinations in the future. And going forward, we will draw on the past experiences and also make a smooth arrangement for the upcoming high school entrance examination and college entrance examination. Second, I would like to brief you on the current online educations in the middle schools and the primary schools. We have providing the online education to the students who are at the primary and the middle schools. And over 70 million students are able to log on the online platform to take classes. And all of these people have learning up to 1.8 billion minutes. And when considering the current prevention and control measures, we have further optimized the current curriculum we have been putting online. On different schools, they also provide online classes to their students. I would like to name a few examples. For example, in Shijingshan, and some of the schools, they're actually opening up classes from the WeChat platforms. And for Daxing district, and for the teachers, they will have a one-on-one with their students to provide some psychological counseling to the students. And for a specific primary school, and their teachers are also doing a self-live streaming, so the students can watch the live streaming at home. And so for Beijing Middle School, they are also optimizing their online classes so that more students are willing to participate in these online classes. So not only these teachers are providing theoretical knowledge to these students, but also they're encouraging the students to doing some off-site actions so that they can learn from practice. Second, per requirement from the prevention and control, we're also coordinating with the universities to implement all of the preventive measures. So in particular, we are rolling out the all-rounded disinfection to canteens and the public facilities in the universities. And also, faculties are receiving nucleic acid tests when necessary. And also, we are doing a good job in facilitating the graduation ceremony for all of the students who are studying in the universities. Third, we are also considering some of the suggestions made from the students who are at the graduating grade. So for example, how to pack their luggages, how to facilitate the students to leave the school. We will fully understand their request and will provide a one-to-one consultation with these people. And hopefully we can provide customized services to all the students. And for some students, they would like to stay in Beijing or stay in their college or university for postgraduate students, and we will do what we can to provide services to the students. Thank you. Now next, I would like to give the floor to Director Guo Hailong from Xiteng District to brief us on the operation of the sample collections in Xiteng District. Friends from the media, I would like to give you an update on the building of the sample collections and the nucleic acid test collection site in Xiteng District. So in response to the municipal government, Xiteng District has set up a special task force and strengthened our resource allocation and also to accelerate the building of the NAT sample collection test. And we will run NAT to key groups of people and making sure that all people can be tested, isolated, admitted, and treated as required so that we can curb the spread of the virus. After we receive the notification from the municipal government, we immediately come up with a working plan. So in a short period of time, we have established a team and identified a site for building the NAT sample collection site. We have selected a spacious place with good ventilation. So in the end, we have identified the Xinjie Forest Park as the designated place for sample collection. And also we are working with the community officials and volunteers to organize the nucleic acid test. So on the 17th of June, we have established a temporary NAT sample collection site. And we started to operate on the 18th of June in order to maintain an orderly manner. In these areas, we have taken a lot of measures. First, we have separated separated the session into like 3 areas, including the buffer zone, waiting zone, and the testing zone. By doing that, we can exercise social distance with others and also can ensure that the sample collection can be collected in an orderly manner. And at the same time, we have to protect the citizens who are taken the NAT. And also we have opened up 8 channels, and on an hour basis, so each hour we can testing 800 people. And also we are doing what we can to roll out the disinfection. On site, we actually have ambulance on site and also set up sunshade umbrellas so that we can better support the work of the healthcare workers as well. We are also working jointly with the local authorities, so these people can help to direct the traffic and provide a safety guarantee for all the people who are receiving the nucleic acid test. And to key groups of people, we have completed the sample collection of 12,000 people, and right now everything is going smoothly. Going forward, we will continue to carry out the territorial responsibility and guide the nucleic acid test for our local residents, and to provide the services for the NAT testing sites to make sure that we can build a stringent defensive line in Xicheng district and protect our people's safety and health. Thank you. That is my update. Thank you. Now is the Q&A session. Please identify yourself before you raise your question. With CMG, my question is to Mr. Li from the Beijing Education Commission. So I'm actually asking a question on behalf of the graduates from the colleges and universities. And some people, before they leave the universities, they're actually leaving some of their luggages in the schools. And right now, they're saying that the situation is improving in Beijing. So these students are asking whether they can take their belongings away on their own. And also for some graduates, they also want to send their luggages to their working places. However, those working places may not be able to receive their packages. So what shall we do? So first of all, thank you for your question. You actually asked like 3 questions. So first, they're asking whether they can go back to their schools to collect their belongings. And the second is about their privacy, how to protect their privacy. And the third is about their employment situation. They're asking whether their luggages can be sent to their working places. So first, I would like to share a few comments. So today is quite unique. So for students who are coming from the graduating grades, they're under great pressure and challenges. So these people are facing challenges of proceeding to a higher grade or entering into the society or employment, etc. As Education Commission, we have fully considered their requests and needs. You could see start from April, we are starting to facilitate the returning of school of students who are coming from the graduating grade. However, now you could see there's a change in the epidemic prevention and control in Beijing. We have to make some adjustments. We have to adjust some of the measures in accordance to the response level, and at the same time, we have to provide support to the graduating students. And for these days, we do see a lot of concerns from the graduating students. In particular, they're focusing on their belongings and the packages. Actually, we have done some work to facilitate this group of people. For example, last night we have organized a video conference to make arrangements. So I would like to share some of my thoughts. With the change of the response level, the graduating students are not allowed to come back to school. By doing that, we can protect our students so they don't have to come back to school. And right now we think we have made the right decision. Even though some experts are saying that the situation in Beijing is improving, but still we see an increased number of new confirmed cases, and also we have more places that have been turned into mid and high risks. So that is to say, the situation right now is still challenging. We are still under a lot of pressure. And for the universities, we cannot consider that as a local residence or a local community, because for the universities they have like supermarkets, community space, and also they have densely distributed dormitory, public toilet, library, etc. Because of all of these features, this will pose challenges for the management of the universities in terms of the epidemic prevention and control. So with the cluster outbreak occurred in Xinfadi, it reminds us that we have to pay attention to the environment. Especially we have to do disinfection to those public facilities, for example, the libraries, canteens, dormitories, etc. For all of these places, we have to do what we can to disinfect all of these places. So based on our evaluation, before we complete this thorough disinfection, it's unlikely that the students can go back to school and collect their belongings. And also we see we have like limited opportunity for disinfection. So we have to seize every available time and second to complete the disinfection to the public facilities in the universities. So please show your understanding, because right now we have to do this thorough disinfection. Even though the freshmen have not yet come to the university, but still right now we have to conduct the disinfection. Because we think the environment in the universities is quite unique, we have to take special measures to fulfill the needs of the prevention and control of the epidemic. And second, you have raised some questions about the delivery of their belongings, and especially about the privacy of personal belongings, etc. On these circumstances, we may appeal to all the universities. They have to respect the feelings of the graduating students. We believe all of these graduating students are feeling reluctant to leave school, leave the university, so we have to help them to pack their belongings. We should not use a sweeping approach in this regard, and we also emphasize these points in the video conference happened last night. We're saying before we conduct our work, we need to have a one-to-one communication with the graduating students. So we were taking a customized approach to help them to pack their belongings. And also we saw some of the universities, they are doing a good job in this regard. For example, after they are gaining approval from the students, probably they can run a live streaming on how they pack the belongings of the students. Also, we can find friends from the graduating students to help with the packing. After we packed the belongings of the graduating students, we will store these belongings in a designated place, and later on they will send out these packages to the students. And of course, if you have some questions, you can raise all of these questions to the universities, and the schools will make sure that we can protect every student's privacy and to protect the safety of all of their belongings. And also some students are asking whether the university can send out these parcels and the belongings to the workplace. So I think at this point, the workplace can talk directly to the universities and to make arrangements accordingly. At this point, all of the universities are facing grave challenges. But still, I think the priority is that we have to disinfect all the public facilities to ensure that we have a good disinfection and also a good ventilation for all the indoor places. Especially all of this work should be done before the new semester. So since the beginning of this year, I would like to appreciate all the hard work made by the students from the universities. So these people are staying at home, they are not returning to school, and also they are participating in the fight against COVID-19. And also for students who are graduating from the medical schools, they're also participating in the COVID-19 fight. So they're actually demonstrating the spirit of patriotism. I believe all of the Chinese people will be proud of you. So now is a special time. I believe many people are facing challenges. So maybe we are not able to take a graduation photo with all of you. But I would like to make a commitment in the future. If we are organizing this graduation ceremony, we welcome all of you come back to the university and attend the graduation ceremony. Thank you. Next question, please. With Beijing Broadcasting Center, my question is also to Mr. Li Yi. The day before yesterday, the Education Commission have published a guidelines on the college entrance examination, and you are seeing that for some of the students, they have to wear face mask during the examination. So how can we implement all of these measures? And also I want to understand for the college entrance examination in Beijing, so do you have other measures to be published? Thank you. Yes, we do found some of the notification published by the National Education Commission. Well, for all of those measures that have been included in that guidelines, we will fully abide by those measures. And of course, we have to make sure that all the measures can be implemented. To Beijing, we are actually facing double challenges because right now we are still facing a lot of challenges for the epidemic prevention and control, and also we're facing with the uncertainties brought by the new types of college entrance examination. But still, we have to follow the principle to put students' safety and health as the top priority. So we have to prepare for the worst scenario and to come up with a more comprehensive guidelines so that we can put equal emphasis on the prevention control as well as the implementation of the college entrance examination. And what we do is that we can, first of all, we have to check the health condition and the body temperature of all the students to make sure that they're safe. And also, we will consider all the complexities that involves in the examination. Actually, on Saturday, we have conducted a machine examination for the listening test for English. Even though we are using an innovative way for the examination, but we still have to pay equal emphasis on the disinfection of all the examination halls. And also we have to provide customized services to the students and provide psychological counseling to the students and to comfort their nerves and to provide guidance to all the different kinds of universities and the schools so that they can come up with a contingency plan. At the same time, we will put up with a plan to facilitate the students to go to the examination hall. As for the specific guidelines in Beijing, for different testing sites, we have rolled out disinfection, and also we have different draft plans for the procedures of the examination. So everything is underway. So as you are talking about what is the arrangement for the entrance examination and what requirements we need to do to support the students, so everything we have under our consideration. And also we consider students in special groups. For example, what happens if they have fever or coughing, etc. But in terms of the release of the guidelines, we plan to roll out these examination guidelines by the end of June, which is next week. So we will publish these examination guidelines in due course, and also we will provide sufficient training to the faculties as well as the students so they will understand all the requirements listed in the guideline. Thank you. Next question. Thank you. With CCTV Finance, my question is to Mr. Gao Xiaojun. And many people are saying that we have some medical workers from Hubei province and other provinces coming to Beijing to support the fight against COVID-19. Can you tell us more about the details? So thank you for your attention to this issue. In order to enhance the NAT testing capacity in Beijing so that it can cover a large group of people in Beijing, recently, National Health Commission has allocated medical resources from Hubei and Heilongjiang, and altogether, they have formed 10 testing groups with 210 medical workers. And these people are coming to Beijing to provide support with the nucleic acid test. By doing that, the nucleic acid test capacity can be improved in Beijing. It is estimated that on a daily basis, the daily capacity can reach 30,000 people. For the 10 teams, they will be arriving in Beijing in recent days and start their job. This demonstrates the strong support from the CPC Central Committee to Beijing City, and also demonstrates the attachment between the neighboring cities of Beijing. Beijing has followed the guidelines from the CPC Central Committee and the State Council. We would like to work with our neighboring cities to win this battle against the COVID-19. Next question, please. With labor paper, I have a question. For example, if I am a close contact with a confirmed case, however, I tested negative, does that mean I can go back to work and I can live my normal life? I don't need to have a isolation, or I have to be isolated? Now I would like to give the floor to Mr. Li Jiming to answer your question. Thank you for your question. As a close contact, if you tested negative in the NAT, this time during the epidemic, many patients, they're actually at an early stage of their symptoms. So for you, if you are a close contact of a confirmed patient, meaning that you have a high risk of infection, if you are tested negative for NAT, you still have to undergo quarantine or isolation because you have a higher risk compared to other people. You have to stay at home for isolation, and later on you can recheck your NAT to see whether you are safe or not. Next question, please. My question of China News Service, my question is also to Mr. Li Jingming. It's about the accuracy of NAT. For some people, they're not tested positive for the first time. Does that mean these people have to undergo a second type of testing? As for the accuracy of the NAT test, so we have to consider the two types of test results, whether positive is accurate or negative is accurate. For example, if you are tested positive, meaning that you are infected with the virus, however, some of the samples may have contaminated. So these people are not virus carriers. So by doing that, these people may have to undergo a second type of testing to make sure that their testing result is accurate. However, if your test shows negative, sometimes this may not be completely accurate. So for example, if you are just develop symptoms at the early stage, maybe it is very difficult to identify a positive or active virus on your sample. And at a later stage, some of the virus will be active. And also we are talking about some people are taking the throat swab and the nose swab, and by all of different means may show a different level of accuracy of the testing results. And also we have to consider whether the medical workers have been taking these samples in an accurate manner. And all of these may have an impact to the results. And also we have to consider the use of the reagents. We have different types of reagents. Some of these reagents may not be used effectively in the nucleic acid test. So that is to say, for some people, maybe their testing results are not completely accurate. So for COVID-19 virus, so it may easily mutate it. However, at the earlier stage, it will not be mutated. However, with the development of the virus, especially when this mutation happened on the second stage or the third stage, and it will have some impact on the testing results. So right now we are using different kinds of reagents to run this nucleic acid test. So by a combination of usage of the reagents, it may help to improve the accuracy of the testing results. But still, it is inevitable that from time to time, some of the results are not accurate. You have been asking, if you are testing negative, does that mean you are safe, or do you have to come back for another testing? Sometimes it's very hard to say. In answering your questions, I would say that you have to consider more factors. For example, for people who are receiving the testing, you have to consider whether you have you have been contacting with those close contacts or have been contacting with the confirmed patients. So as I have just said, there is a variation of the testing results. So if you're not feeling safe, probably you have to run a second test to verify your result. So especially if you are coming from the medium to high risk regions, so maybe you should run the test again to make sure that you are not infected with the virus. Last question. With Beijing Daily, my question is to the member from the Beijing Education Commission, Mr. Li Yi. So for some of the students, they are doing online classes, but still some parents have coming up with some questions. For example, some of the students, they are quite indulged with games and they're not fully engaged or dedicated in the online education. So how to deal with these problems? And also, the summer vacation is coming. Will the Beijing Education Commission come up with some measures to regulate the students? So thank you for your question. And just now I've just talked about the arrangement of the graduating grades. However, the parents are also concerned about the students who are at the different grades. So for most of the parents, they have been cooperative with the Education Commission. They are doing a good job in the prevention and control for the epidemic. And the parents also attach great importance to the mental condition of the students, especially for some of the students, they are quite indulged in games and their study efficiency is low. And of course, we have to consider all of these aspects. Last time I was saying we're actually approaching to the last stage of this semester, and for some of the schools, they're preparing for the final exam for the semester. And for different schools, they will also organize an online examination for the students. So I would like to make a few points. First, from grade 1 to 3, in the primary school, we will not organize the final exams for this semester. So we will just give some online tests to understand their knowledge about this semester. And for grades above 1 to 3, we will organize some online examinations to the students. So probably we will have a limited time and we'll ask the students to fill in the questionnaire, etc. And some parents are also concerned about the assignments sent by the teachers to the students. And they want to understand the arrangement from the schools. Actually, from next week, we will send out relevant notifications to give you more details. And also we have a special arrangement for the final examinations for this semester. But of course, we have to pay utmost attention to students' health. And also we encourage all the students to do some exercise when they're staying at home and keep a good daily routine so that they can fulfill their study for this semester. And of course, it actually takes extra energy for the student and for the parents to look after their kids at this special time. So this time, we would like to have a thorough communication with the parents. As I have just said, we need to have a one-to-one communication with the parents and the students and provide guidance to the parents. And when necessary, maybe the teachers will provide some remote assistance to the parents to look after their kids. And here I would like to make an appeal to the public. Indeed, in these past 6 months, it is quite tough for all the students. We have to pay attention to their mental health as well as their physical health. So for the kids, they would like to go out and have some time together with their peers, but during this special period of time, they have to stay at home. And we have to show extraordinary care to all of those students and kids. So I hope the public can provide more support to families who have a kid. So by joining hands and working together, we can offer a healthy environment for the students and the kids. And you also asked a question about the summer vacation, also arrangement for the next semester. And right now, schools at different districts, they're coming out with the specific plan. Especially, they are coming up with a guideline and plans for the arrangement of the summer vacation for all the students in Beijing. First, for different districts and the schools, and they will take a proactive manner to serve the students. So that does not mean we will provide an extra burden to the students. And the second, for the Education Commission, we will closely follow on the situation of the students and help them to prepare for the new semester. Thank you. That comes to the end of the Q&A session. And this press conference is organized by the Information Office of Beijing Municipality. You can also watch this live streaming online through multiple media platforms. For example, the CCTV application. And also this live streaming is also available in a couple of radio channels. For example, you can hear this live streaming from the transport radio, and also you can also follow us and from the BTV News channel. Thank you all the speakers and thank you all the journalists. So that's the end of today's press conference. Thank you.